If you're over 60 and you wake up at night to pee, most people say, that's just aging. But what if that is the mistake? Because waking up once may be normal, but waking up 2, 3, or 4 times every night may be your body leaving a warning sign. And the scary part is this: it may not be your bladder. It may be blood sugar. It may be sleep apnea. It may be your prostate, or something your body is trying to reveal at 2 a.m. Welcome back to Senior Health Research Host. I'm Alex. I'm not your doctor, and this video is not medical advice. My job is different. I analyze doctor warnings, compare the evidence, and turn complicated health topics into simple questions you can take to your own doctor. And today we're looking at one nighttime symptom many seniors ignore: nocturia, waking up at night because you need to urinate. Cleveland Clinic defines nocturia as waking up more than once during the night because you have to pee. Causes can include drinking too much fluid, sleep disorders, bladder obstruction, and other medical issues. But here is the part that matters. Nocturia is not one disease. It is a clue. It can come from the bladder. It can come from the prostate. It can come from blood sugar. It can come from sleep apnea. It can come from the heart, kidneys, medications, or even what you drink before bed. So Alex's first question is simple. Are you waking up because your bladder is old, or because your body is warning you? Let's analyze the 5 biggest warning patterns doctors talk about. Number 1, nocturia and diabetes. If you're over 60 and you are waking up several times at night to urinate, one of the first things doctors often think about is blood sugar. The CDC lists frequent urination, increased thirst, increased hunger, fatigue, blurry vision, unexplained weight loss, and frequent urinary or yeast infections as possible symptoms of diabetes. Mayo Clinic explains the basic mechanism clearly. When extra sugar builds up in the blood, the kidneys work over time to filter and absorb it. When they cannot keep up, sugar is excreted into the urine, pulling fluid from tissues and causing more urination and thirst. So the question is not simply, do I pee at night? The better question is, do I wake up to pee at night and also feel unusually thirsty, tired, hungry, blurry-eyed, or dry-mouthed? That combination is much more important. And this is where many seniors make the mistake. They say, I'm just getting older. But if nighttime urination comes with thirst, fatigue, blurry vision, or unexplained weight change, that deserves a blood sugar conversation with a doctor. Not panic, not self-diagnosis. A check. Number 2, nocturia and sleep apnea. This is the one many people never connect. They think the bladder wakes them up. But sometimes the sleep problem comes first. NIDDK lists obstructive sleep apnea among health problems that can cause someone to urinate frequently at night. It also lists conditions such as UTI, kidney stones, congestive heart failure, chronic kidney disease, and prostate enlargement as possible causes. Here's the real-life version. A person snores loudly. They stop breathing briefly during sleep. Their body wakes up again and again. Each time they wake, they notice the bladder. Then they think, my bladder woke me up. But the real trigger might be the disrupted sleep. Do you wake up to pee? Or do you wake up first, then decide to pee because you're already awake? That distinction matters if nocturia comes with loud snoring, morning headaches, dry mouth, daytime sleepiness, or a partner saying you stop breathing during sleep. That is not just a bladder story. That may be a sleep story. And sleep matters. Mayo Clinic notes that nighttime urination is a common reason older adults wake at night, and that it also increases the risk of nighttime falls. That is why nocturia is not just annoying. It can affect sleep quality, balance, safety, memory, mood, and independence. Number 3, nocturia and bladder or prostate problems. This is the most obvious one, but it still needs careful thinking. In men over 50 or 60, nighttime urination is often blamed on the prostate. Sometimes that is correct, but not always. Mayo Clinic explains that overactive bladder can cause sudden urges to urinate that are hard to control, frequent urination during the day and night, and sometimes urgency, incontinence. So here is the simple self-check. If the problem is prostate-related, a man may notice weak stream, difficulty starting, stopping and starting, dribbling, or the feeling that the bladder did not empty completely. If the problem is overactive bladder, the main feeling is different. It is urgency. I have to go right now. If I wait, I may leak. I know I just went, but I feel the urge again. That difference matters because the solution may be different. A prostate problem, bladder problem, medication issue, diabetes issue, or sleep issue can all look like the same symptom at night. That is why the worst answer is, it's just aging. A better answer is, what pattern is my body showing? Number 4, nocturia, and the heart, kidneys, or fluid shifts. This one sounds strange until you understand the body mechanics. During the day, fluid can collect in the legs, especially in people with swelling, circulation issues, certain medications, heart problems, kidney issues, or long hours sitting. Then at night, when you lie flat, that fluid moves back into circulation. The kidneys filter more fluid. The bladder fills. You wake up. Cedars-Sinai states that nocturia can be caused by lifestyle habits such as drinking fluids before bedtime, diuretics, caffeine, and salt. But it can also be caused by conditions such as high blood pressure, diabetes, heart disease, and enlarged prostate. So the self-check becomes, do my ankles swell during the day? Do I take a water pill? Do I drink a lot of fluid late at night? Do I use caffeine in the evening? Do I eat salty food at dinner? Do I wake up more on days when my legs are swollen? This is where Alex should be careful. We are not diagnosing heart disease from nighttime urination. That would be irresponsible. But we are saying this: if nighttime urination comes with leg swelling, shortness of breath, chest discomfort, unusual fatigue, or worsening blood pressure, do not dismiss it as normal aging. That is a doctor conversation. Number 5, nocturia and medications. This is the part that fits perfectly with Senior Health Research host. Many older adults take several medications. Some are necessary. Some save lives. But timing and combinations matter. NIDDK includes certain health problems and related causes in nighttime urination, and many urology resources also discuss medication timing, especially diuretics, as a factor in nighttime urination. If someone takes a diuretic late in the day, they may be sending themselves to the bathroom all night. If someone drinks coffee late, takes certain blood pressure medications, uses sleep aids, or combines multiple pills, the nighttime pattern can change. So the question is not, which pill is bad? The question is, could the timing of my medication be making my nights worse? This is a powerful video moment because Alex can say, sometimes the problem is not the medication itself. Sometimes the problem is the clock. If a doctor prescribed a diuretic, do not change it yourself, but ask, should I take this earlier in the day? Could any of my medications increase nighttime urination? Could any of them make me dizzy when I get up at night? That last question is critical, because the danger is not only peeing at night. The danger is getting up half asleep, walking in the dark, feeling dizzy, and falling. Now let's make this practical. Here is Alex's nocturia pattern checklist. Question 1. How many times do I wake up? Once may be common, but 2 or more times regularly deserves attention, especially if it affects sleep or safety. Question 2. Is it sudden urgency, weak stream, or large amounts of urine? Urgency points more toward bladder control. Weak stream may point more toward prostate obstruction in men. Large amounts of urine may point more toward fluid, blood sugar, kidney, or hormone-related causes. Question 3. Do I have other symptoms? Thirst, dry mouth, fatigue, blurry vision, snoring, leg swelling, dizziness, pain or burning, blood in urine, shortness of breath. These change the meaning of the symptom. Question 4. What did I drink after dinner? Coffee, tea, alcohol, too much water, sugary drinks, high salt meal? Question 5. Could medication timing be involved? Water pills, blood pressure medications, sleep pills, cold medicines, supplements. Question 6. Is this new or getting worse? A symptom that slowly appears over years is one thing. A symptom that suddenly changes is different. Question 7. Is it causing falls, poor sleep, or daytime fatigue? Because even if the cause is not dangerous, the consequence can become dangerous. Now here is the strongest line in the whole video. Nocturia is not embarrassing. Nocturia is information. It is your body's nighttime report. Sometimes that report says you drank too much tea before bed. Sometimes it says your bladder is overactive. Sometimes it says your prostate needs review. Sometimes it says your blood sugar should be checked. Sometimes it says your sleep is broken. Sometimes it says your medications need timing review. And sometimes it says, please stop calling this normal aging. So what should you do? For the next 3 nights, write down 4 things. What time you go to bed. How many times you wake up to urinate. About how much comes out, small, medium, or large. And what you drank after dinner. If you want to be more precise, add, did you snore? Were your legs swollen? Did you feel thirsty? Did you feel dizzy when standing? Did you have burning or pain? Then bring that pattern to your doctor, not a vague complaint. Because doctors can do much more with a pattern than with a sentence like, I pee a lot at night. Instead, you can say, for the last 3 weeks, I wake up 3 times a night. It is usually a large amount. I'm also thirsty and tired during the day. Or I wake up twice, but only small amounts come out, and I feel sudden urgency. Or I wake up more on days my ankles are swollen. Those are different stories, and different stories lead to different questions. That is the point of this channel. We do not panic. We do not pretend one symptom means one disease. We analyze patterns. So if you're over 60 and waking up at night to pee, do not feel ashamed. Do not ignore it. And do not immediately assume the worst. Just ask the better question. What pattern is my body showing me? If this video helped you, subscribe to Senior Health Research Host. I'm Alex. On this channel, I analyze doctor warnings, compare the evidence, and turn them into practical questions you can bring to your own doctor. And before you leave, write this in the comments. How many times do you wake up at night? Once, twice, or more? Not to judge, to start the conversation. Because sometimes better health after 60 begins with something very simple. Listening to what your body is trying to tell you 2 a.m.